Support for WMNF comes from listeners like you and Florida Southern College in Lakeland, where visitors can experience a Frank Lloyd Wright architecture-guided tour featuring 13 Wright-designed structures. Tour reservations and details can be found at flsouthern.edu.
Hi, this is Tinsley Ellis, and you're listening to member-supported community radio, WMNF Tampa.
The opinions presented on the Healthy Steps show are the evidence-based opinions of Dr. Fred Harvey, the callers, and his guests. These are not the opinions of the staff, the volunteers, or the board of WMNF. The information provided on the show is not intended to diagnose or treat any disease. There is no implied patient-physician relationship in these calls. The nature of the calls is educational and informational only.
Hello there, my bewitching listeners. I cannot thank you enough for keeping your radio tuned to WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and the only discerning community-supported radio station that the Pensy Preparatory School streams, and you can stream us as well at WMNF.org. Today is Ask Me Anything Monday, so your wait is over. If you have any medical questions or concerns, give Dr. Harvey a call at 813-239-9663. Once again, that number to dial is 813-239-9663. You can also send an email to dj@wmnf.org. Good morning to you, Dr. Harvey. You've got another Ask Me Anything Monday ready for us today, so let's get started, shall we? What have you got in store for us today, Dr. Fred?
Good morning, Bill, and all you healthy steppers out there.
And good morning back at you there, Doc. Great to be here today.
I agree. Another day in paradise. So, there's always stuff happening. And I read an article in the Sunday New York Times. Actually, it was a 2-page center spread on the opinion section. And it's entitled, "He Grew Up on Antidepressants. Now He Wants a Way Out." Cameron was started on antidepressants at age 4. Cameron was started on antidepressants without a medical workup. Cameron was started on antidepressants, from my perspective, inappropriately, because he had a mood disorder. A mood disorder that was ill-defined, a mood disorder that was not evaluated by the doctors in other ways than simply asking about the symptoms. The reason I say this is inappropriate is because he's 24 years into it, and he wants out, and he's been having significant difficulties with his ability to withdraw himself from these addictive chemicals. They're not described as addictive per se, but they are. Nearly everyone has difficulty getting off of them once they're on them, especially if they're on them for long term. When I first started training, this was 40 years ago, guys, I read the PDR. You know, it's like 3,500 pages. I didn't read every page, but for all the medications that I used, I would read those package inserts because they gave us valuable information. And every one of them on every antidepressant said, after 6 months, reassess this person and see if they still need it. And yeah, I guess that's sort of done, but it's not really reevaluation. Simply the visits are a re-prescribing event. So after 6 months, the only question I think that ever gets asked is, are you feeling okay? And if the person says yes, then the prescription continues, rather than, oh, okay, maybe you've improved now and we can try something differently. Or while we are treating you with these shocking, mind-altering chemicals, we can do something else to support you. Cameron's been trying for like 3 years to get off of his medications. It's been very difficult. And the reason is that they're treating symptoms rather than treating biology. And it really is rather distressing to me to understand that it's not really the psychiatrists that are having the biggest difficulty here. They are, because they want to get reimbursed. But the real problem is that we have a system that legislates that we have to do it this way. The National Institutes of Mental Health has described the Diagnostic Statistical Manual number 5, DSM-5, published in 2013 by the American Psychiatric Association, as a research, not tool. It can't be used for research because it doesn't describe biology. It doesn't describe medical syndromes. It describes sets of symptoms that they've put labels on. I've said this before, and it's going to be said again because psychiatry itself is beginning to challenge this. It's really good to know that they understand they're in a bind. I'll get to that. The bind is that they are forced to use the ICD-9 for diagnostic codes because that's the way our insurance-driven system works. Centers for Medicare and Medicaid services are both they're requiring that these inappropriate codings be used. The reason I say they're inappropriate is because we have a biologic basis of mood disorders, a significant biologic basis for mood disorder. Numerous clinical research studies show that the way I work up someone with mood disorder is actually appropriate because we look at urinary neurotransmitters. And I'm looking at 5 clinical studies right now that I just pulled off from a research review. 5 clinical studies that support what I'm talking about. Urinary neurotransmitters, low dopamine, low serotonin, low vanilla mandelic acid, are associated with depression. And in numerous ways, we have other ones also. There are other biomarkers too that are really interesting that aren't looked at. So in my workup of a new client, I use a test called the NutraEval. It's a metabolomic test that looks at the organic acids that run the system. These organic acids and other cofactors are showing up as things that are very important. Aminomalonic acid, azelaic acid, and hippuric acid identified as characteristic markers for these mood disorders. In addition to the neurotransmitters, here's something else that's really fascinating. Inflammatory markers are consistently elevated in depression. IL-6, tumor necrosis factor alpha, IL-1B, and C-reactive protein. A very simple thing that most primary care doctors can do. They're consistently elevated in depression. But are they actually because of depression, or they are causing the depression? I think that it looks like they are causative for mood disorder. And we know this because we know that when someone has inflammation, they have disrupted emotions. Think about how badly you feel when you have influenza. All those cytokines, those inflammatory markers, are circulating and causing your brain to dysfunction. IL-6 specifically, which is often elevated in autoimmune diseases, is linked to suicidality. Vitamin D modulates serotonin synthesis. Does anybody check a vitamin D level? Some, not most. I don't know a primary care doctor that actually checks omega-3 levels. I know primary care doctors actually prescribe most of the SSRIs, the antidepressants linked with addiction. Low levels of omega-3 are linked to mood disorder. EPA, a specific omega-3, boosts serotonin release. DHA enhances the serotonin receptor function. Sex hormones. Estrogen, progesterone, and testosterone shifts are tied to mood change. Minerals. Iron, magnesium, selenium, zinc, inversely associated with depression risk. Homocysteine and MTHFR. Homocysteine, MTHFR are related to folic acid metabolism. There is almost a 7 times increased risk of what's been described symptomatically as major depressive disorder. So we have all these things that are known to do it. So why is it, here's the question, why is it that psychiatry doesn't test for these things routinely? And they have an official rationale that's very based in the Western medicine magic bullet thinking. No biomarker, no single biomarker has sufficient sensitivity or specificity to replace symptom-based diagnosis at the individual level. Well, that's because there is no one biomarker that causes it all. It's a symphony. So you have to look at the whole picture. But that's one thing that most Western medicine doctors are terrible at, is looking at the bigger picture. They hone in on their little silo and order one test for one thing, and it doesn't relate to the rest of the reality they're experiencing. Then they say that group level differences, mass population differences don't reliably discriminate individual patients. Well, duh. This is the whole point of personalized medicine. You're dealing with an individual in front of you. Why are you trying to treat a mass population? That's very weird thinking. And Mendelian randomization. So this is like genetic kind of randomization. Found no causal role for vitamin D or omega-3 in major depressants. Well, so what? It doesn't matter that sort of randomization doesn't find a causal role. Think about causal role. They're still wanting to play the name it, blame it, tame it game. Make up a label, blame something for it, and then cure it by fixing the problem you've made up. That's not the way it works. The body is a whole system. So omega-3 deficiency is going to disrupt the system, but it's not a treatment, a line item treatment for depression. It's something that helps your body work better. If you have low vitamin D, but you have adequate omega-3, you'll still have a problem. If you have adequate D and low omega-3, you'll still have a problem. You need to fix the symphony. And the DSM-5 has 227 symptom combinations for one diagnosis. Biologic heterogeneity that no single biomarker maps onto. Of course. These are all the arguments of people that don't understand functional medicine's multifactorial approach to human existence. The way we actually exist, not in this silo of scientific one-liners. That's not the way biology works. And the standard workup they use is really ridiculously narrow. A blood count, a simple metabolic panel, look at your sugar in your kidneys, a thyroid, a B12, a folate. They don't even look at C-reactive protein, omega-3, and the sex hormones, which we know actually do it. And by golly, they're never going to look at a urinary neurotransmitter because that's what they call quackery. Oh, my word. And then they... it really does break down. I've been hitting on that. But here's really the key. The serotonin hypothesis, with which they consider treating everyone with Prozac, Paxil, Zoloft, and all of the other SSRIs, they only have a 35% real-world remission rate. It's not causal. Right? The standard is not applied to pharmacotherapy because we know that low serotonin doesn't cause it. It's just something that's found during it. And the biomarker diagnosis mismatch predicts worse outcomes. In other words, if you don't test for these inflammatory and other indicators and treat the person, they get more ill. This is actually proven in clinical research, 2026. And deficiency corrections work. Randomized control trials, the gold standard, the actual gold standard, show that B vitamins, vitamin D, and omega-3 reduce depression scores. So they actually fix mood. It's not a cure for a disease that doesn't exist, because depression actually, I have to be convinced that it actually exists because no one has actually shown me the biology of depression. When they do, we can talk about it. And this whole thing persists because it's legally required for Medicare reimbursement, insurance billing, and FDA drug approval. There's no valid alternative diagnostic system because they want it simple. They want line items. You can't scale talking to a person for 2 hours. You just can't do it. And pharma funds the research, so pharma is directing you towards pharmaceutical intervention. This is the capitalistic approach to research. If we didn't have pharma funding the research and we all funded it ourselves, we'd find out answers that were more applicable to reality. There's a reimbursement infrastructure that supports the insanity. And professional identity is stuck. They're going to favor the status quo because, my God, change in medicine happens one death at a time because they're going to cling to their old ideas. And the Journal of the American Medical Association Psychiatry 2025 called the Diagnostic Statistical Manual a restrictive framework hindering biological stratification. My suggestion to go forward is that we actually look at reality and we start testing C-reactive protein. Any primary care doctor can do it. The Omega check that I look at, you can get that at Quest. And there are many different models of approaching treating these elevated inflammatory and other markers or deficient markers. And I think the burden is in the doctor in making better choices for the client to give them options for ways to deal with this. Bottom line is that really robust, replicable evidence connects depression to measurable biology across inflammation, nutrition, hormones, methylation, and the microbiome, but no one is studying except for functional medicine doctors. I'm challenging psychiatrists to step up at the plate and learn what these things mean and how to actually intervene. Because having a 28-year-old man trying to get off 24 years of inappropriately prescribed antidepressants is a real problem for us. And it's time for us to move forward and talk about it. And I'm here to talk with you because this is the Healthy Step Show, and I am Dr. Fred Harvey.
Hey there, Dr. Fred Harvey. I've got Darren waiting on the line, but first I want to invite everyone else to give us a call here at the Healthy Steps Radio Show at WMNF Tampa. Just give us a dial at 813-239-9663. That number to call with your medical questions or concerns is 813-239-9663. Good morning to you there, Darren.
Good morning. Thanks for having me this morning.
You're welcome.
I'm a first-time user, so you have to tell me how this goes. Do I
ask me a question? Yeah, just tell me what's on your mind, and we'll go from there.
Okay, so I had cancer, and it was a glioblastoma, and I've had it removed by surgery. I had 3 surgeries, 3 brain surgeries, and I am always tired. In addition to this cancer that I just had, diabetes came on, which I was kind of pre-diabetic before, but now I'm diabetic because I'm monitoring it, taking metformin, doing what the doctors tell me to do, and I'm just always tired, Doc. I'm exhausted. They told me oncologists that don't take any supplements right now, like B12 or any D vitamins or anything. But they just gave me approval because my last MRI showed no more progression of the cancer to start taking some B12 and D3. But man, I'm just tired all the time. It's exhausting. I mean, it's not like I went and worked out and I'm recovering. I'm just extremely exhausted, and I know, or from the research that I've done, a little bit of research, that my inflammation is a big problem, and my hormones, the insulin hormone, doesn't get into my cell, and my cells are inflamed, from what I understand, and so the glucose is in my bloodstream and not getting into the cells to be burned by the mitochondria. So my question is, I'm just giving you a little background of what's going on with me, and I'm fighting this going to MD Anderson. I'm fighting this, all the aches and pains and the hurt. I'm hurting a lot, and I just don't feel good, nauseated. But I've done the chemo, I've done the radiation, I've done the surgeries.
Oh, so you're finished with the chemotherapy and the radiotherapy?
I am, yes, sir. I did all of that already at MD Anderson.
Oh, okay. So that makes a lot of sense. Most people that have completed a course of surgery, chemotherapy, and radiotherapy are often very fatigued because these things devastate your metabolism. And there is currently no nutritional supplements been conclusively shown to promote glioblastoma growth in any clinical study. They're very cautious, but they're cautious to an extreme sometime. But you were doing chemo and radiation, and there's a theoretical inference that maybe you'd have some interference with the destructive nature of chemo and radiation if you take the supplementation. However, you're finished with that now, and you deserve a metabolic workup to find out what's causing your fatigue. But there are a couple things to think about. One, diabetes is an energy production impairment. Metabolizing carbohydrates makes energy. So if you have a carbohydrate metabolism impairment, then you have an issue with energy. Basic. That can be looked at metabolically and worked on with other things than simply metformin.
Right.
And then I think it's really important to actually look at your vitamin levels and your metabolic or your metabolomic numbers. Your brain's not going to work if you don't have enough omega-3. Your detox systems aren't going to clean up the mess if you don't have enough antioxidants and detox support. So I think you deserve a functional medicine workup because we're the specialty that helps people recover from what Western medicine does in the name of fighting illness.
Yes, that's exactly along the lines of what's happened. I've been kind of told to hold back on the supplements because all this chemo and radiation, it wore my body out. I mean, my gosh, just wore me out, and I'm still recovering. I asked the doctor, oncologist, how long does it take for me to feel normal again? It could take 2 years. That's what they told me. I was like, whoa, didn't realize it'd be that long. But tell me about this functional medicine, metabolic workup stuff. We see online a whole bunch of stuff about, detoxing and the root cause, the primary cause of the diabetes is, metformin is just masking the problem, but
Correct.
Like you said, it's not my cells aren't working where they're burning that glucose.
Right, and so some of the things you can do are to eliminate glucose intake. There is evidence that the ketogenic diet actually is very helpful in patients that have glioblastoma. There are several clinical studies out there that show that there is an improvement in survival rate. There is an improvement in response rate, and there is overall, it will also help your diabetes and your energy production.
We're talking about eating a lot better, Doc.
No, I'm talking about a ketogenic diet. Look that one up online. Keto. It's not eating better; it's eating differently. No carbohydrates.
I pretty much. I mean, I do have some carbohydrates once in a blue moon now. That's what they tell you when you have diabetes. Eat no carbohydrates or very low carbohydrates and no sugar. I eat no sugar at all.
Good. So you're doing a lot of the right things there. So then you might want to look at a metabolomic test like the Genova Diagnostics NutriEval. It looks at your organic acids. It looks at your amino acids. It looks at your essential fatty acids, your omega balance, to see where you are with these things. It looks at how well you're metabolizing B vitamins. And it gives you a really good idea of what's going on there. We can also look at vitamin levels, vitamin B12, your omegas and your D, and see where you are. I think it's really important to get data, and I doubt that the oncologist has looked at your nutritional status because it's not something I've ever seen any of them ever do.
Yeah.
This Friday.
I'm sorry, what? What's that, baby?
On Friday, your B12 was checked by the oncologist.
That's one out of 100 different biomarkers that could be looked at.
Gotcha.
So you can go to ifm.org, Institute for Functional Medicine.org, and you can do a physician search, 25, 50, 100 miles, and see if you can find somebody there that matches what you want to look at. And that way you can get a good functional medicine workup and figure out what's next.
Functional medicine workup.
Yes, ifm.org. Look for a functional doctor.
Hold on one second. Let me write. Okay. We got it. Okay, I just wanted, my wife is here with me. So, okay, so we'll look for that. It's just this whole lingering effect of no energy is just gets me a little down, and I'm trying to...
I can understand that. And so you're having mood changes because of metabolic changes. So I think it very much is worth it for you to look at the metabolic problems, fix that, and see if your mood gets better and your energy gets better.
Is it something where, okay, I do the workup and then they can tell me, okay, you're deficient here, you're deficient there, here's what can help you with this and who can help you with that? Is that more?
That's exactly the way I work. I look at the data and then give you recommendations that you can change in your life so you can be more functional. That's the point of functional medicine. Improve your function.
Yeah, that's what I need.
Yep. Okay. So best wishes on your search there. I'll be glad to talk to you again anytime here. Have a great week, sir.
Bless you. Thank you so much, Dr. Harvey. Thank you.
You're so welcome.
Yeah, thank you there, Darren, and do stay in touch with us. I've got another caller that's been waiting patiently. Let's go to the caller. Good morning to you now.
Yes, I'm taking methylcobalamin for muscle spasms. Anything I can substitute for that? Because it seems like to be not working that well.
I missed what you said. What did you say is going on?
I'm taking methylcobalamin for muscle spasms. And I want to know if there's something else I can substitute because it seems like not work that well, the methylcobalamin.
What's your name?
Ed.
Ed. So, hey, Ed, you're asking me a very Western medicine-oriented question. You're asking me for a substitute for a line item medication that's not working for a problem that you described as muscle spasms. First things first, we don't know why you have muscle spasms, and we don't know what's going on, so that makes it difficult to make any kind of therapeutic suggestion. And the other thought is that if methylcarbamol is failing, and I know methylcarbamol is an excellent muscle relaxer and it helps with muscle spasms, there's another reason. There's something that they're missing, and I don't think that any other muscle relaxant is your answer. You need to find out why it is your muscle's not relaxing with one of the most potent muscle relaxers available in pharmaceutical medicine. Does that make sense?
Yes.
Good. So I would, again, as I told the last caller, Darren, you might want to go to ifm.org, Institute for Functional Medicine.org, find a functional doctor near you and get a better workup than what you've had.
Okay, thank you.
You're so welcome. Have a great day and good luck with that. Let us know how it works if you can.
Okie dokie there. Let's go to Susan. Good morning to you, Susan. Well, let's get back to Susan in just a second there. Go on, doctor.
Oh, no, that's fine. Susan's ready.
No, she's not.
Ready for her. Oh, she's not? Okay. So no callers?
No callers at the moment there, doctor.
Okay, very good. So, I think that these last two callers brought up some very good thoughts. Western medicine is excellent at treating an acute illness. And so when somebody is diagnosed with something as horrible as a brain tumor called glioblastoma, which has uniformly terrible prognosis, he's done really well. MD Anderson is an amazing cancer institution, and they provided him with some state-of-the-art therapies that 10 years ago wouldn't have happened. He's had treatment that has him still alive, and that is so amazing because glioblastoma is one of the hardest tumors to treat. But now he needs support because the treatment caused consequences. And then the other doctor or the other patient who is using a failed medication needs a better workup. Both people need some functional evaluation so they can figure out what's next. How do they recover from the problem that they've got? And I think we have our caller back.
Yes, indeed we do. We've got Susan, and I'm going to invite other folks to give us a call, too. We're down to about 25 minutes. If you've got a medical question or a concern, give us a call at 813-239-9663, and you can participate in the Healthy Steps radio show with Dr. Fred Harvey here, WMNF Tampa. That number once more is 813-239-9663. Good morning to you, Susan.
Yes.
Hi, Susan.
My question is, my spouse has been diagnosed with Parkinson's disease, and as I understand it, that involves neurotransmitters, and it was identified that maybe he could be treated for depression, and he took a medication for about 6 to 8 months. And then I discussed it with him about is it helping or not, and so forth and so on, and didn't get much idea that it was. And so he tried weaning off of it and came off of it. And there's really not been any difference one way or another. But I'm fascinated with what you're saying about testing for neurotransmitters in the urine. But how does a person ever find functional doctors? I've read about that before, but you want to know what you're doing when you go to a new doctor. And,
yes.
Is there any website to identify people in certain geographic areas?
Yes, Susan, I just mentioned it to the last two callers. The website is Institute for Functional Medicine.org, ifm.org. They have a physician finder there. You can put in 25 miles, 50 miles, 100 miles, and search that radius for doctors that practice this way. It'll bring up a list, usually with pictures and descriptions of the practices. So you can see that if there's a practitioner near you that simply does gynecology, that's probably not going to be the person you want to talk to about mood and Parkinson's disease. Right. And so, you can actually, many of us, like I do, telemedicine, and so you might be able to find people from all over if you even search a larger radius that do this kind of approach. There are 1,000 of us that are certified now. That's only 0.1% of all doctors in America. There's 1 million doctors, 1,000 of us certified. So we are in the vast minority, but we're there and ready and willing to help.
Okay, good to hear.
So that's the approach I would take, because Parkinson's is related to inflammation, and it's often caused by pesticide exposure. So there's all kinds of things you can do to reduce the potential for continued worsening if you clean up the inflammation and the toxicity in your body.
Yeah, and I happen to feel like a lot of that's related to diet, including I think being a vegetarian is the fastest way, if you're pretty strict about it, to decrease inflammation. But it's hard
you have to also you also have to avoid the pesticide foods. You need to pay attention to the dirty dozen, clean 15. If you're going to be vegetarian, you don't want to eat strawberries, peaches, apples, iceberg lettuce, bell peppers, hot peppers, kale, spinach, potatoes, if they're not labeled organic, because they're poison factories that actually promote more Parkinson's disease.
Yes, it's hard to convince people to spend the money to do that, but I try.
Well, do you want to die of Parkinson's and cancer, or do you want to live a more healthy, functional life? It's an easy question.
Yeah, I've asked people that question, but it's not easy for people.
Well, it bounces off off a cranium that's not willing to listen to new information. It scares them.
That's true. You're right about that.
Yes, change is scary for most people. And so, good luck with your change. Look for a functional doctor and get on this pathway to clean up the system. Sounds like you already understand it.
Yeah, I do. It's hard to convince someone else. I'm trying, though. Thank you.
Well, if you're talking about your husband, right?
Yes.
Well, I'm living in America, and I think that in America, usually the wife's responsible for dinner. Are you?
Well, I think your words are, he's listening to you too, so maybe he'll believe you. He doesn't believe me too much.
Well, as the new foods show up in the table, maybe he'll grasp it. Love it. Have a great day and good luck. Hey, husband, good luck with your disease. I think you can improve.
Thank you. Goodbye.
Thank you very much there, Susan. Let's go to Christopher. Good morning, Christopher. Hello.
What do you got for me, Christopher?
Well, let's go to the other line here. Good morning to you. You're on the Healthy Steps radio show.
Hi, can you hear me?
Yes, who am I speaking with?
This is actually Christopher. You had me on the wrong line.
Okay, great. Hi, Christopher.
Hi, good. Thanks for all you guys are doing. I appreciate this forum. I'm actually calling for a friend of mine who lives in Oregon, so he can't listen to WMNF except online. I'll direct him to the show later. But just to get to the point, he's come down with depression. He's in his late 40s. He doesn't know where it came from. He doesn't know what's going on. He's been battling with it for about 6 months now. He eats healthy. He works out. He has a sauna. He also comes from a family of alcoholics. He has battled with drinking himself. He's cut himself down to minimal, like 1 or 2 glasses of wine a day. He used to smoke ganja. He's quit that. He used to do a lot of other things, but he's quit all of that. So he's a car salesman. He's usually positive and upbeat and a go-getter. And for some reason, he doesn't know why, he just can't break out of this. He can't get out of the bad mood. He can't get out of feeling this overwhelming despair. He's newly married. He's been married for about 3 years. He's divorced, has a child. His ex-wife has been really hard on him with the custody battle and turning his preteen son against him. So there's a lot of things going on, but nothing that he's never been able to overcome before. And I'm wondering, what could functional medicine do for him? I've already sent him the website today that you've announced, the ifm.org. But
yes.
Just hearing this little bit, is there some approach we can go for him to start looking at to turning this around without going to SSRIs or antidepressants or amphetamines or anything like that?
Yeah, so you gave me some really good information there. COMT is a gene, or actually it's an enzyme that is coded for in your genes. And there is really strong evidence that if people have an abnormal COMT, which is part of the metabolism of catecholamines, adrenaline, noradrenaline, the stimulants.
Okay.
People with abnormalities in that system tend to be more likely alcoholic, bipolar, depressed, and suicidal. His family has a history of alcoholism. It's not unlikely they have a COMT gene problem. And so it is really worth it for him to get a functional evaluation, because even if we don't look at the genes, we look at the way the B vitamin metabolism goes behind the scenes using a test like the NutrAval, looking at the metabolomic organic acids, not looking at your B12 level, because that doesn't actually reflect, or your folic acid level, that doesn't reflect how the COMT gene is working. And then you look at neurotransmitters, because when you look at the neurotransmitters, you can see changes in neurotransmitter metabolism that reflect bad COMT. You can look at hormones. Hormones will also reflect methylation, which is part of COMT. And so I think that anybody like your friend who has a sudden mood shift deserves a full annual, lab metabolic workup with the usual blood count, chemistries, lipids, thyroid, sugar, what a general doctor would do. But then add to that the metabolomic test called the NutrAval from Genomics, or from Genova Diagnostics, and a comprehensive neurotransmitter urine with a HUMAP, HUMAP, human urine hormone metabolism map from Doctors Data Incorporated. These are vastly potent and useful tools for looking at what's going on in the person's metabolism that would direct mood in a bad way. Because you can have low testosterone that could do it. You could have disruptions in the neurotransmitters. And I think if somebody has this history, this family history of alcoholism, ganja is a better choice than the alcohol, because any dose of alcohol is going to feed forward into the depression, because that's what it does, especially in people who have this genetic abnormality. But I don't recommend that he goes back to ganja either. If he's already off of it, I'd say taper off the alcohol completely as a first step towards clear thinking.
Got it. Okay. Thank you so much. Could you repeat that urine hormone, the
HUMAP. It's called the HUMAP.
HUMD?
HUMAP.
HUMAP. Got it.
Yeah,
Human
it's the HUMAP.
urine.
And then I add to that the comprehensive neurotransmitter, which gives you an idea of the methylation of your neurotransmitters, which is what COMT does.
Got it. And that would all be able to be gotten at a functional medicine workup.
Absolutely. You got to find the right functional medicine doctor and ask if they'll do those tests. If they're not comfortable with that, you just need to keep looking, because there's a bunch of us out there, and we all have slightly different styles.
And then you said something about the Nutramal genomic diagnostic.
Nutraeval, Nutraeval, and that is a metabolomic test that Genova Diagnostics does.
I'm sorry, can you repeat that one more time?
Nutraeval, Genova Diagnostics. And
Genova Diagnostics, okay.
Yes, GENOVA. If you go to GENOVA, you'll find all their labs. And if you go to Doctors Data Incorporated, you'll find all their labs. They have a vast array of amazingly solid, robust labs that are all CLIA approved. CLIA is the government certifying body that says this lab is okay to bill Medicare. So they've passed that very high bar. And I know that Genova Diagnostics has also passed the very, very high bar, the highest on the planet, called the American College of Pathology. They are tested by pathologists who are the laboratory doctors, and their laboratory accuracy is super high. So we have some really good quality labs here that aren't actually usually tested by primary care doctors or even specialists.
Okay. Did you say Doctors and David Inc.?
Doctors Data Incorporated.
Oh, Doctors Data Incorporated. Okay. Thanks, Dr. Harvey. This is really, where else can we get this kind of information in a public forum like this? Thank you for what you're doing.
Very few places. And if he contacts or looks at my website, you'll get a lot more information there about it. And he may even want to fill out the toxiflammation interactive questionnaire that we have online there. It can give him or anybody else who's listening today, if you go and look at that toxiflammation questionnaire, it'll tell you how much your body is feeling inflamed and toxic right now. Because it's a very, it's not just, do you have this disease? It's how are you feeling right now?
Mm-hmm. Okay, what's your website?
Functionalmedicineflorida.com. So best wishes on that. Hope your friend gets better quickly.
Thank you so much. Have a great day.
Okie dokie there. And yes, best wishes to your friend, and thanks for calling on in on his behalf. And you can call on in, too, to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa by dialing 813-239-9663. Once again, that number to call is 813-239-9663. Back to you there, Doctor.
So, yes, I think it's really important to understand that we have so many options for taking care of our health. And so many new things are coming up in the information that's being gathered constantly by so many good research scientists. And so I think, simple things are out there, adding some fish oil if the brain fog is from low fish oil, It really works. But I'm impressed with the calls today because people are really interested in looking for answers, and that is really hopeful. Here's an email from Jerry. Jerry asks, is there anything good to stop eyelids from twitching? Yeah, I wonder, has anybody out there ever noticed that your right eyelid just starts going and you can't do anything about it? You feel like you're blinking, but you're not. It's just this constant high frequency twitch going on. Our nervous system is very interesting, and it will, when it's irritated, trigger things like that. And it's possible that the eyelid twitching is due to some emotional stress. It could be due to some metabolic imbalances. Unless you have kidney problems, magnesium is a really good solution for muscle spasms or twitches. And in fact, the first caller, I believe, the second caller, Ed, magnesium glycinate is a calming agent. Up to 400 milligrams a day, if there's no kidney problems, is tolerated by most people. It may not be enough to change the issue, but it may be something worth it to calm you down. And glycine also calms the nervous system. So if you look for magnesium glycinate, Glycinate, you might actually find a solution for this kind of problem. And Janie has asked, what is my opinion of the odd chain fatty acid 15, specifically pentadecaenoic acid? Lots of push in advertising right now. Well, my opinion is that whenever something is being advertised, it's generally less important than it seems to be from the advertising. There's a lot of hype in supplement sales these days, and I'm really not terribly interested in line item supplements any longer unless I do a test and I find out that somebody's deficient. That's one of the pitfalls and traps of doing integrative nutritional medicine. I found out when I started doing integrative medicine before functional medicine, it became a substitution game where I'd substitute a line item supplement for a line item medication with mixed effects. Sometimes it really worked. Sometimes it didn't do anything. And so I realized that that's not the most effective way to consider supplementation. I think that we need to look at supplementation as part of a symphony, that adding simple line items are not necessarily the way to address biologic imbalance unless there's a very glaring hole. Like if I find somebody who has an omega index that's 2, when heart health starts at 5 and brain health starts at 8, I'm going to recommend they eat more fish or take fish oil. But I test it. I don't just randomly say it. Sometimes I do if the person has brain fog and they tell me they don't eat fish and they don't take flaxseed or any other omega, then I might recommend they get on omega to begin with, because that will promote a little bit better outcome, function. I think we have a caller.
Indeed we do. We've got Rod on the line. Good morning to you there, Rod.
Good morning.
Hi, Rod.
How you doing?
Doing well. How are you?
I'm good. How are you?
So, what you got for us today?
A few years ago, I was getting up in the middle of the night, going to the bathroom. I'm in my 60s, and I figured my PSA was up, so I went in and got my blood work done, and they said, no, the PSA was fine, but my resting blood sugar was 300, and my A1C was 12.5. So, obviously, you're type 2 diabetic. You got to get on insulin right away, so forth and so on. And I said, no, I have a daughter that's a type 1 diabetic that we found out when she was very young. So we dealt with endocrinologists for a while, so I had some knowledge of diabetes. I did accept the metformin, but I completely changed my diet. And within 6 months, I had my blood sugar down to just a little over 100, and my A1C was down to 5.2. The question I'm asking, you were talking about the dirty dozen. And what I basically did, of course, I dropped about 35 pounds. I wasn't drinking the craft beer all the time, wasn't eating a bunch of garbage, the fast foods. I cook at home a lot more. I cut a lot of carbs and mainly a lot of the sugar out of my diet completely. I feel better. I have more energy. I didn't have to go on the meds. But I do eat a lot more vegetables. I try to stay on the low glycemic index for fruits, the berries and stuff. But yes. I have heard you mention about the dirty dozen. If you don't, is there a way, because I've been washing my fruits and vegetables with the water, with the baking soda. I don't know if that's does that help at all if you buy non-organic stuff?
For the dirty dozen, that is now like the dirty 15, no, because you can't wash off the pesticide residues that are in the flesh. And so if you want to be healthiest, you avoid eating the dirty dozen, which you can find at environmentalworkinggroup.org. You can download that little card. You can put in your wallet, whatever. It is things like apples, peaches, strawberries, blueberries, kale, iceberg lettuce, bell peppers, potatoes, spinach. These are all poisons if they're not labeled organic. And so there's no way to clean it off.
But there's no way to get it. Well, that's what I figured. They spray the stuff. I imagine it grows with it in it, so there's no way to get around it.
Yeah, it sucks it out of the soil and it penetrates the flesh of the strawberry.
Right. If you buy organic totally, then it shouldn't have those pesticides in them, then, is what you're saying?
Yes, but you don't need to buy it organic totally, because if you look at the Clean 15, which is also on the flip side of that same list, those are the things that either don't get sprayed or don't get residues. Things like avocados. No pest can eat through the avocado skin. Bananas, same deal. Nothing wants to bite on the nasty banana skin to eat through to it. There is a fungus that eats bananas, and we're going to lose the Cavendish one day, but the other bananas don't seem to be susceptible to the same blight that the Cavendish gets. And so, and actually the banana you're eating today resembles a Cavendish, but it's actually a hybrid that's genetically resistant to the fungus, so they don't have to spray it. Onions, garlic. No pests eat onions or garlic, so they don't get sprayed. But broccoli can get sprayed.
Mm-hmm. Yeah, I do eat a lot of broccoli because it is good, but I usually buy organic broccoli.
Good.
So that's and it, like I said, it completely changed. They wanted to put me on insulin and this and that, and I said no, and I didn't think it was necessary, and I did turn it around. And I do take supplements. I take magnesium glycinate every day. I take a good 1-a-day vitamin. I do the apple cider vinegar once a day in a glass of water. And I've been doing that for a while. And I feel a lot better. I have a lot more energy. Obviously, my blood sugar and all my other stuff that they do, and they do a normal blood work, everything came back into line. And Edith said, whatever you're doing, keep doing it, because it's working.
Keep doing it, my friend. Good luck with that. I got to sign off now. It's the end of the show. And I would like to just give this last text message an answer, because I can't answer it otherwise. The Cancer Treatment Center that I mentioned, that the patient mentioned earlier for Chris in Gainesville, is MD Anderson, Houston. And I want to thank everybody. Great interaction today. Thank you for all calling in. Thank you, Bill, for producing the show and always doing a great job there. And I believe Lauren is answering the phones. Thank you for doing that and keeping the show rolling.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants, listeners, and supporters. You make this show exemplary. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.